My name is Melissa. I am with the academic specialty team at Aspen. Thank you, Doc, for doing this, and thanks everyone for hopping on. You might see me kind of a little all over the place. I have a screen here, a screen here. I have to kind of bounce between what we're doing here and the questions that are being submitted and the attendees that are coming on. So we like to joke around and say that it's mission control over here. So if I'm not looking at the screen, I'm listening. I'm just trying to, get things situated over here. I have been with Aspen not even a year, but in that short period of time, I've learned so much about the company. Been fortunate enough to attend a lot of events before COVID happened. And so now, since the pandemic is happening, we're not able to travel and do live events. So we're doing these kind of virtual sessions in place, and they're working out very nicely. They're real informative and helpful to anyone interested in working for Aspen, but it's not the same as being live. So hopefully we get back to doing that at some point. Doc, I'll let you have the floor for a second if you want to introduce yourself and give us a little background.
Hi, everyone. Thanks for joining us tonight. My name is Bob Sorella. I did my residency at the University of Pittsburgh a long time ago. I got done in 1993, and Aspen Dental I don't think existed back then. So I did some things before joining Aspen Dental. So when I first got out, I joined another oral surgeon as his associate. And I was there until about 2000, 2001. We still have a good relationship. We're friends with each other. The original intent of that was that I would join his practice or buy into his practice at some point, and then eventually take it over. He was older than I was at that point. He actually, matter of fact, just retired a few years ago. But I ended up not staying there. And my career path is a little bit unusual. After that, while I was still with him, I got interested in doing hair transplants for guys losing their hair. So that was a big part of my practice for many years. It was the majority of what I did until I was doing it while I was together with him, but I was doing that almost exclusively until around 2006 when I joined Aspen Dental. So Aspen Dental, when I can't remember how I originally found out about it, but it wasn't a well-known entity in the area we lived in Pittsburgh. I'm in Pittsburgh, by the way, still. And I think the first Aspen Dentals were opening, and somehow, I'm not sure, I must have approached somebody or I'm not sure how the original contact occurred, but when it started out, I kind of dipped my toe into it and worked a little bit part-time, and very quickly, things went very well very quickly, and I became full-time in short order after 2006. And I've been with them ever since. So I've been with Aspen Dental 14 years now.
Nice. I will say you're the first dental practitioner that I have met that did hair transplants. So it's interesting, very interesting. And I worked in dental before Aspen. So first I've heard of that, but yeah, nice.
I can't remember if I talked to you about that before, but
no, it's funny. It's funny. Everyone's background is so unique, but that's the first I've heard of that one. So thanks for giving us your background. I kind of want to start off before we get into the questions for you, Doc, just to kind of explain a little bit about what Aspen is about, their model, and what exactly is a DSO. Because I think sometimes, we're in the business and maybe we take for granted that everyone listening kind of knows exactly what a DSO is. Did we lose you, Doc?
I'm still here. Someone's calling me. So.
Oh, okay. No problem.
Yeah, okay. There we go. Another dentist is calling me that wants to work here. So.
Oh, so you see, we're getting popular. So I like to, start with a little bit of a kind of an explanation of exactly what a DSO is, so that, in case anyone has any questions about that or misconceptions, we can kind of, clear that up. So First off, a DSO is, a group of dental practices operating under a common name or an umbrella of some sort. And they can be regional, so that can be a state organization, or it can be national like Aspen. What makes Aspen a little different is that our offices are owned by general dentists. So the company I work for is ADMI, which is Aspen Dental Management. And we provide the support for the clinical offices, but the offices themselves are owned by a general dentist. They are owned by a clinician. So then some people would say, well, if you're going to own the practice anyway, why would you want to work under the Aspen umbrella? And I always kind of explain it like this. You're a dental student, you're coming out of school. Oh, there's my dog. Sorry, guys. He's on neighborhood watch. So you're coming out of dental school or residency, and let's just say by some miracle you don't have a ton of student loan debt and you have some money and you want to open up a practice right away. Well, where do you start? Well, you probably don't have the money to open a practice, so you have to go to a bank and find a loan officer. And then you probably don't know much about real estate, so you have to go find a real estate agent to help you source out a location and a lawyer to help you with the lease. And then, you have to get your network set up. So you have to hire someone in IT, and that person needs to know, exactly how an IT network has to operate in a medical or dental facility because of HIPAA regulations. So it can't just be, Joe Schmo's IT. You have to get your computers and everything else that goes into the technology in the office. You have to get someone to do your payroll and an accountant, and you probably didn't learn too much about marketing in dental school. So now you have to find a marketing consultant. Where are you getting your gloves from? You have to get a supplier. And then a couple months down the road, you're taking a look at the business and you're saying, okay, it's not exactly where it needs to be. So now you get a business consultant in to help you look at things like how you can fill your schedule and HR and a million other things. So I'm sure you guys can kind of see where I'm going with this. In that quick, synopsis, I mentioned 10 different people that you would have to rely on in order to own your own practice. That's where Aspen comes in. So we are a partner with the office. We support everything that you do in the office that is non-clinical. And ADMI's financial interest is 100% aligned with the success of your practice. And so that's where, when people say to me, well, why would I want to come over to Aspen? That's why. Everything that I just mentioned that you don't learn in dental school, we've done 875 times at this point, because that's how many offices we have across the country. So again, anything non-clinical, anything that's business related, we provide the support for the practices. I think that makes sense, right, Doc?
Yes, it does.
So we'll get to the question and answer. So for all of you attendees, there's a question and answer little button at the bottom of your screen. So you can click on that, type in any questions that you have. You can be anonymous, or you can, say who you are. That's fine either way. And we'll just answer the questions as they come in. So the first question we have is, how did you get to do hair transplants? And what other cool things can an oral maxillofacial surgeon do that is out of the ordinary?
Well, I got interested in them when I was a resident. I did one case, actually, someone that lost an eyebrow, and we reconstructed it by doing hair transplants. So I got interested at that point. And then when I got out into practice, Pittsburgh actually had a pretty big, pretty well-known, one of the early big hair transplant practices. People used to, we used to run a national infomercial, and people used to fly into Pittsburgh to get it done, mostly in the Eastern US. So I got involved in that. I approached them and I got interested in doing that. And for a while, I mean, I did a lot of it. It was the bulk of my practice. I was pretty big in it for a while, but to be honest with you, this is better. So I wouldn't be doing this if this wasn't better. I enjoy this better.
Yeah. Any other interesting things that you know of that an oral surgeon can get into?
I mean, when I was doing my residency, a big thing was cosmetic surgery. So I've seen some that, have gotten involved in that. I spent a little bit of time with some that was the bulk of their practice exclusively. They didn't really do what we would consider oral surgery, but I think they were the exception, not the rule. Yeah.
I know a lot of dentists, even general dentists, are starting to do Botox now. I've
Yes.
seen
Yes.
that in a lot of
I know
offices,
some.
which
Yeah. I don't know
I
any with
swear I
me.
know nothing about Botox.
Yeah. I actually did it for a while for, if I knew someone, just a friend. And I did a little bit of it while I was involved with the hair transplant practice. I did some of that and fillers, yeah,
So your patients left your office looking good.
we hope. Yeah.
Okay, so what equipment does Aspen provide for you, and what do you have to get on your own?
Long story short, Aspen provides everything for you. Um, they will, I mean, when I came in, it wasn't as organized as it is now. So I actually had a lot of my own equipment when I first came in and came in with it. And what I didn't have, Aspen bought for me. But now, if you come in now, they're very in tune to this. They've done this many times. Many oral surgeons have come in since I've come in, and they will have a list for you of what they suggest you get. And, you can add to that or take away from it, depending on what you like, what you don't like. But because it's such a big entity, they've arranged, there's certain monitors that almost all of us use. And we were involved in choosing it, but that's the monitor almost all of us have. And I'm sure Aspen has arranged like a good rate to get the monitor, but it boils down to all your equipment comes from Aspen. And correct me if I'm wrong, Melissa, I don't think we really are charged for that equipment, are we ever? Because it's a CapEx expense.
Correct.
Yeah, so all that equipment is bought for you, and it's not, you never actually have a deduction from your pay for the equipment part of it. Any bigger purchase like that is not charged to us.
That is correct.
Mm-hmm.
And that's a nice segue into the next question, which is, do you have access to, or do the offices have cone beam?
Have what?
Cone beam, CBCT.
Cone beam, yes. When I started, no one had it, but now the majority of the offices have it. Not every single one, but the majority of the offices have that now.
So all
in
of
my
our
region,
brand,
at least. In my
yes,
region, at least. Yeah.
and all of them, every single one of them will have a cone beam by the end of next year. So that was supposed to be the end of this year, but COVID kind of, threw a wrench into a lot of things for this year. So all of our new offices are being built with the cone beam in the office, and the older offices are being retrofitted for them right now. So again, by the end of next year, you'll have them in every office. And most of our dentists find that, like you mentioned, there are a few in the region that do have. So if you need to get one for a patient, you can just send them to a neighboring Aspen office to get the scan. Let's see. So, well, you kind of alluded to this already before, but getting to choose your own equipment and supplies, can you choose what you want to use, or does Aspen have preferred brands?
I'm sure there are preferred brands. It's been a long time since I got my instruments. So
Well, what about supplies in general, as things that you order on a regular basis? Are you able to get the things that you want?
I can't recall in 14 years ever being told I couldn't have something, but a lot of the things I want come from where I used to order them anyway. So they order from Shine. They have a good relationship with Shine. As far as I know, Aspen is the second biggest Shine customer. So
That's correct.
after the United States government, right?
That's correct.
Right. So we get a good rate on everything. It's one of the advantages of working with Aspen. We get a good price for everything that we buy from Shine. The dental implant company that we're associated with most closely is Nobel Biocare, and we get a very good price for Nobel Biocare implants. if you're in love with a different implant, I think that's fine too. But there are a lot of advantages to getting Nobel Biocare implants because, I mean, it's sort of in my opinion, one of the best implants, if not the best. And the rate the price that Aspen Dental buys them for, they've negotiated a very good price for the implants. So you can pretty much get whatever you want. There are advantages to getting the preferred things because it will keep your overhead down. But if you don't want that and you want to get something else, I don't think there's any problem. Am I correct?
Yep, that is correct.
Yeah.
And of course, you mentioned an advantage of using Nobel is obviously we get a really aggressive rate on the implants because we order so many. But the other advantage of that is, like you mentioned before, about us being Shine's biggest customer outside of the US government, we're a very important customer to them. So, same thing with Nobel, we're a very important customer. And so the support that we get from them is just, it's going to be better going with that than it is going to be going with a different implant that we don't order as frequently. So it's not only a cost benefit, it's also from the support side. Okay, so are you charged for your anesthesia medications, and can you use whatever medications you like in the practice?
There is a deduction from your pay for the supplies, and there's not a deduction for the original equipment to set you up, but for things that you use every day, there is a deduction from, there's like a calculation that happens every month for your pay, and anesthesia drugs are subtracted from it. The whole cost isn't borne by the doctor. It's borne partially by the doctor, and then the other part is borne by either Aspen Dental or the doctor that owns the offices that you're doing the oral surgery for. And you can choose whatever you want. I think most of us are using the same things, but you can choose whatever you want.
Awesome. So that kind of goes into this next question. Can you discuss how your overhead works, i.e. buying implants, paying assistants, et cetera? So you kind of started on that track, so that's a good segue.
It's kind of all done for you. I'm not real actively involved in it, which is one of the nice things. I don't order the supplies. My assistants order the supplies as we go through, the month. Aspen Dental is very computerized, and everything is very organized. You can access everything. One of the nice things is I walk into the office every day with an iPad, and everything I would want to see is on that iPad. Even when I'm not in the office, I can look at, the supplies that are being used and charged out. I can look at my schedules on the iPad. But at the end of every month, everything that you've ordered that month shows up in an accounting, there's called a profit loss section, and I can see everything that's been ordered, and that's subtracted from the amount of money that's collected that month. So when you go into work, you can see the amount of money that's on the schedule that day. And one nice thing that's different about Aspen Dental compared to other arrangements is you're paid at the end of the month before that money is probably actually collected. You're paid on what Aspen Dental expects to collect on that, and they have been at it so long that what they expect to collect is correct, very close to the right amount. So you finish up the month, and instead of the usual arrangement where you have to wait for that money to be collected, they know what will be collected, and you're paid on what will be collected at the end of the month. So that it starts with that number, what will be collected, and then your supplies are deducted from it. And there's a percentage that you're paid of the collections. The supplies, the cost of the supplies is, the cost of it is divided based on that percentage as well. The percentage is the same. So whatever your percentage of the that you're going to be paid on the collections is also the percentage that will be charged on the supplies that are ordered that month. And it's nice to be able to see it because, you know, part of this is, you know, if you can, you want to try to keep the cost of the supplies down. So that it wasn't always done that way. When I first started, the supplies didn't really show up in what we did, but you know, it makes sense, and it creates an incentive to just get everything that you want. But now the way it's set up is you see the supplies, and because they're deducted from what you're making, you have an incentive to try to keep them under control. Yeah.
Sure. Makes
And
sense.
not waste them. Yeah.
Yep. Makes sense. You mentioned about being able to see on the iPad expenditures. What about like patient records, patient information, who's in your schedule, x-rays?
Yeah, it's
Can you see that?
actually, you know, I've been at this a long time, and it's amazing how much it's changed over the years. But what we have now, I think, is really nice, and I'm not sure that it's available. You know, everybody has this. If you go into a private practice, the private practice I was with had nothing like this, but the IT part of Aspen Dental is fantastic if you're into that. So I basically have the little iPad that I can see everything on that iPad. I can see my schedules. I basically can log in remotely to the whole Aspen Dental computer system, and I can see anything I want to see, whether I'm home or whether I'm in the office or whether I'm in my car. It's really nice. I love it.
So that was a big investment that Aspen made for our specialists. So for our oral surgeons and our endodontists, because you're traveling to different locations, you know, we saw the need that you needed to be able to access these records because you're not in the same office every day. So it's glad, you know, I'm glad to know that you guys are liking it because, again, that was a big investment that they made.
Yeah, it's fantastic, and it works really well.
Awesome. That's good to hear. Let's see. So what do you travel with and how do you transport it?
Well, some of that is between you and your assistant, who has what.
Okay.
But basically, and it depends on the state you're in. In some states, some stuff has to be in the office, but in Pennsylvania, we travel with all the hand instruments, the surgical instruments. We travel with the drill, all the drills and that part of it. And then we have the anesthesia monitor, and I have my anesthesia emergency stuff with me, other than the defibrillator. The AED is in each office, and each office also has oxygen. Each office also has an ambu bag, but I still have my own ambu bags. But that's basically what's being moved around from office to office. The implants are being moved around from office to office. We have those ourselves as well. And in my particular case, my assistant has some of it and I have some of it. She basically has the hand instruments and the drills and the implants, and I have the anesthesia stuff. We're not moving drugs around from office to office. We used to do that. We don't do that anymore. The drugs are ordered into each office separately and accounted for in each office separately. So those aren't being moved around between offices. So you're not traveling with that part of it. And then how you move it around is kind of up to you. I've been doing it a long time. I have some cases that I like to use, but the the instruments are all sterilized and bagged, and then packed in a case, and then we move them from office to office that way.
Awesome, thank you. And I apologize for the distraction in the background. I sent my kids upstairs to my mom's apartment. I guess next time I have to send the dog too. Something's going on out there. I don't know. He's going crazy. Okay, so a question about sterilization, since you mentioned you're traveling, with certain instrumentation. So how is the sterilization being handled if you're traveling with the equipment? So you had said, are you doing it at the end of the day in the office that you're at and then bringing it to the next office?
Yeah, what we do, and everybody may do it a little bit differently, but what we do, it's sterilized before we leave the office and bagged and then put into a case. And then when we go to the next office, it's already been sterilized. You could also, I'm not sure if anybody does this, but you could also go in. I don't think anybody really does this, but you could go in and sterilize it all before you start. But as we go through the day, it's they keep up with it. After every case, they sterilize a batch of instruments. And then when we leave at the end of the day, everything has been sterilized before we take it away, and it's been bagged and packed up in a case.
Awesome. I had an endodontist actually that I did one of these with last week, and she started using cassettes, which is another really nice thing, especially when you're traveling, with instruments. The cassettes, it's kind of a newer thing, but they are really nice and much easier to transport. So that's something that, if any of you out there are listening and you're using cassettes now in your residency or at whatever practice you're at now, we can get those for you as well. Okay, so let's see. Do you work with the same dental assistant in every office?
Yes, and that's a really good question, because if you don't do that, this would be a very hard thing to do. So that's what makes this doable. And those assistants are the difference between things going smoothly and things being rough. The assistants I have now are fantastic. One was with me even before I started with Aspen Dental, so she's been with me basically since I started in practice. So when I joined, I brought her in with me. I work with three. Two of them work with me on any given day, but I have three. One of them is with me every day. She's my main assistant, and she's fantastic. If you find the right person, it almost feels like just walking into your office every day, because she gets there a little bit before I do. Everything is all set up for me. If you have someone that's good, I can't think of, in the years she's been with me, I can't think of the last time, something's been left behind somewhere or something's been missing. I mean, it basically works very well. She's very experienced and very good with it. But you have to find that person. And if you already have that person, you can bring them in, or Aspen will help you find that person, or, you could ask them to hire them for you, or you could hire them yourself. But you can choose whoever you want to do it. If you need help finding the person, they'll find the person for you.
Yeah, I'm glad you said that. You can be as involved or as uninvolved as you want in hiring your assistants, right? So if you don't, if you've been with Aspen for a long time and you trust the people that you're working with on the administrative side and they know what you want, and you don't want to take the time to interview and do all of that, you don't have to. But if you want to be involved in every step of the process, and you yourself as the oral surgeon want to hire your own assistants, you can do that too. That's a great point. Is anesthesia monitoring all electronic or handwritten?
I think it's how you want to do it. The monitors we have can generate a strip for you if you want to strip. What I do is I have a surgical assistant that helps me actually do the procedure and handles the instruments. And then I have an anesthesia assistant. I have two anesthesia assistants that split the job. One works on Monday, Friday. One works Tuesday, Wednesday, Thursday. And that anesthesia assistant actually fills out by hand an anesthesia record for me. But if you are used to doing something different, you can do that too. I think our monitor is capable of generating a strip for you.
Okay, cool.
And you could attach it to the anesthesia record.
Awesome. I always love this question. Do you see pediatric patients?
You can if you want. I don't.
That's the answer that everybody gives.
Well, Dr. Chisholm said he sees them on his.
Oh,
but,
yeah.
Yeah, and he likes to see them.
I'm thinking of the endo we did last week. She was like, no.
Yeah, I mean, the patient profile that we attract is not a lot of kids. You know, it's when I go into the office every day, I mean, you'll see some kids here and there, but it's not the majority of the patients in the office. And then you can choose to say whether you want to see them or not. I don't see them, number one, because they're difficult. And then there's more equipment that I have to bring, or that I have to carry around to do that. I have to get pediatric size resuscitation equipment, and there aren't that many patients to be seen. So it would add more equipment to move around. And, you know, I don't think it's justified by the number of patients that we actually would end up seeing.
What types of procedures are you doing? Do you see any complex stuff, traumas, facial, aesthetics, etc.? And then the second part of that question, do you do sinus lifts?
If you come in with Aspen Dental, you can do trauma, you can do aesthetics, but not at Aspen Dental. So you could have your own office or join another doctor and do that somewhere else. When I first started in practice, I did trauma for years. It was a big part of the practice that I joined. At this point, I don't do any trauma. I have hospital privileges, but I did a lot of it for years. And I have courtesy privileges at the hospital. So I can have privileges at the hospital, but I'm not required to be on the trauma schedule. So you won't be able to, I mean, if you're on a hospital staff taking trauma call, you won't be able to bring those patients into Aspen Dental and see them at Aspen Dental afterwards. Now, on the flip side, you know, and this doesn't really happen very often. Someone could come in that knocked a tooth out or chipped a tooth or something like that, but it's not a big part of what we do. You can't really do aesthetics in an Aspen Dental, but you could do it on your own in your own office, or if you work part-time with Aspen Dental, or if you're, you know, we have some doctors that are associates with other doctors and also work with Aspen Dental part-time. They do that in their own practices. Sinus lifts, I don't do them anymore within an Aspen Dental, but you can do that. We have lots of doctors that do that. I just choose not to do them at this point, but I used to do them at one time before I was with Aspen Dental, but I don't do them now.
So what would you say, what kind of procedures are you doing most?
It's dental alveolar surgery and implants is what we're doing, and anesthesia.
Awesome. Do you have autonomy over your treatment planning?
Yes, you have complete autonomy over it. No one has ever stood over my shoulder and pushed me to do anything. Now, the treatment plans are originally, you know, when the patients first come in, they're seen by the general dentist in the office before they ever get to you in most cases. And that doctor will make a treatment plan, put together a treatment plan, and then refer the patient to you if they want you to do something within the treatment plan. If you disagree with something, there's absolutely no problem. You know, if there's something that's been planned that you're concerned with and you want to change it, you would talk to the doctor, and you know, I've never had a problem that way. So there's no pressure. Everything is under your control, bottom line.
Yeah, and I always like to say, if you put 10 dentists in a room and you show them an x-ray, you'll get 11 different treatment plans, right?
Right.
And that happens in any setting, whether it's Aspen, private practice, it really, you know, it just is what happens. So the nice thing that I always hear from our specialists is that in a more private practice setting, if you worked in an oral surgery office, the general dentist is sending the patient over to you. And if there's a discrepancy in what they thought should be done, you're looking at the x-ray and saying, why did they send this person to me? You have to call, you have to email, you have to text, whatever it is. With Aspen, you could just walk down the hallway and say, hey, doc, come here. You know, kind of chat it out in the hallway for 5 minutes and figure out what's the best course of action for the patient while the patient is still sitting in the chair.
Yeah, and that literally happens. It's not that unusual for that to happen. If I have a question about something or it's unclear, I just have my assistant say, can you go get the doc and have him come over and take a look at this and make sure this is what he wants done. Yep. Or if it's something a little more involved, You know, if it's some implants, and I think we should put the implants in a different place, you know. I think everybody I work with respects my opinion, and if I suggest something, there's never been pushback for that. Or if something's scheduled, if there's a third molar you don't want to remove or you're concerned with, if you don't remove it, you talk to the patient, decide you're not going to remove it, there's no problem. Or you know, if you get, I review every patient's health history before they actually come in. So part of what I'm doing every day in between patients is, as patients are scheduled, those health histories are sent to me, and I review them, and you know, I'll get a consultation with their physician if I need to. There are some, doesn't happen often, but there are some that we decide doing their procedure in an Aspen Dental probably isn't the best place to do it, and we'll refer out. Again, there's never been any pushback if we've done that. If anything, the doctors appreciate it because they know I'm protecting the practice from having a potential problem having within the practice.
Sure. Always do what's in the best interest of the patient. Let's see. So kind of a follow-up to that about doing consults. Are you doing your own consults? Is the general dentist ever doing a consult for you? And do you treat many patients with anesthesia without prior consultation? If so, do you feel that in any way compromises their safety?
It depends what you mean by consultation. I've seen every health history before the patient comes in. And if I have questions about it, you know, I write those questions down on the health history, send it back, and the office that is scheduling the patient will contact the patient and get those questions answered, and then that's sent back to me. And then if we agree to go ahead with the procedure, I'll write down, you know, like what you would write in a hospital. I'll write orders for what we want the patient to do before they come in. If we need a consultation with their physician, that's done before they come in, again, by paperwork. As far as consultations, most patients I don't see before they actually come in to have their procedure done. If it's something, you know, if it's something routine, extracting teeth, we don't necessarily routinely see them. I just review the health history before they come in, and the patient isn't scheduled until I okay that patient to be scheduled based on the health history. If a patient wants a consultation, they're never denied the opportunity to have a consultation. Some do come in for a consultation ahead of time, usually not for routine extractions, but if it's something more complicated like implants, they'll come in ahead of time and talk to me, or the doctor will send me the x-ray ahead of time and we'll review it. But for routine things, most people do not come in for a consultation before the procedure. Now, we go over things the day they come in for the procedure, and if they want a consultation beforehand, we're glad to do that. Most people actually don't want that because it's an additional appointment for them.
Sure. How do you handle post-op care in emergencies?
The patient is seen in the dental office by the general dentist afterwards. Every patient gets my cell phone number when they leave the office. So if there's a question from the patient, they can reach me 24 hours a day. If there's a concern or a problem, the patient would first be seen by the general dentist in the office, and then the general dentist would contact me if there's a concern or a question about it. And if I need to see the patient, then I see the patient if I have to. In 14 years of doing this, there have been very few instances where I've actually had to make a trip for something. I mean, I can't recall the last time we've actually ever had to do that.
Does Aspen cover your malpractice insurance?
They cover a portion of it. I think it's $10,000 of it, right? Mm-hmm. Yeah, so they cover the first $10,000. Most of us, I think, are insured by OMSNIC. Aspen has a good relationship with OMSNIC. But the first $10,000 is covered by Aspen, and then the rest of it, if you're full-time, I think. And then the rest of it is paid by us. Yeah.
Yep. And if you're part-time, then it's a prorated amount based on the number of days per month that you work versus a full-time schedule, which would be at least 15 days per month. So you do get some coverage in the malpractice. You just wouldn't get the full 10,000. A question about, does Aspen provide a vehicle for you? If so, is it large enough to carry all of your equipment? I can answer that if you want.
Go ahead.
So if you are a full-time employee, oral surgeon or endodontist with Aspen, which is working at least 15 days per month or more, then you have an option to get a company car, which I believe the last I heard was a Nissan Pathfinder, so I'm sure it's plenty big enough to carry everything. Or you can opt for a mileage reimbursement. Now, if you're part-time, you'll get the mileage reimbursement. You're not eligible to opt in for the car. So full-time, it's either or. Part-time, it's just mileage reimbursement. That's a good question. What do you have, Doc? Do you drive your own car?
I drive my own car. I'm into cars. So
Yeah.
I kind of picked the car I want to drive, but I get reimbursed. My assistants fill out mileage for me, and then I get a check every month for a reimbursement for the car, for gas.
It's currently 45 cents per mile in the reimbursement.
Something like that, right?
So it covers everything.
Yeah.
What percentage of your patients for anesthesia have prior consults, and what percentage are same-day treatments? Do you feel it's more challenging for same-day treatments?
Again, it depends what you mean by consult. Nobody walks in that I know nothing about. So every patient that comes in, I've seen their health history before they come in, and they're not scheduled until I've okayed them to be scheduled. So I get the health history. If it's a 18-year-old kid for wisdom teeth that's completely healthy, I'll sign off on that and say, go ahead and schedule. Now, if it comes in and it's a 80-year-old lady with breathing problems, COPD, a heart problem, then I'll have questions about that usually. Sometimes the doctors in the office know what questions I'm going to ask, and they get them answered before it's sent to me. But if they haven't been answered before it's sent to me, I'll write the questions down on the health history, send it back to the office. The office will contact that patient, get my questions answered. And if it's a situation like that, then I'll send a form over to their physician, and their physician will sign off on them having the procedure done. If I choose not to do it, we just decide not to do it. But no one is showing up that I know nothing about. Every person that comes in, the medical part of it, we've gone over it. So I didn't do that well before, and I used to rely on the doctors in the office to get the medical clearances. But shortly into it, I switched to taking over and doing it all myself. So it's unusual now for someone to come in and we have to cancel the procedure because of a medical issue for the anesthesia. If it does happen, it's because something wasn't disclosed, and we find out about it once they come in. But
sure. And that can happen whether you do a consult with the patient prior or not.
Yeah, and it's I'm basically doing that for every patient that's coming in.
How many offices do you cover, and how many offices can you cover as an oral surgeon?
I mean, there's a limit to how many you can cover. Right now, I have 14, but I've had over 20 at some point. What starts to happen is the longer you're here, the markets mature and the offices get busier. So it kind of depends how busy the office is. When I had over 20, I'd go to each one at least once a month. But now I have offices that have gotten busier, and some of them I go to more than once a month. So what we ended up doing is a colleague of mine came in and joined when it started to become too much. And we divided it up a little bit. So he has some and I have some now. I'm just as busy as I was before after we did that. But right now I have 14, and some of them I go to more than once a month.
Nice. Travel. How far do you drive to your farthest office?
The furthest I go is 2 hours. When we divided them up, the doctor that divided the territory up with me is older than me, so he was looking for offices that are closer to home. He's actually my neighbor. We live in the same neighborhood. So, and
So you
he,
got stuck with the farther offices?
well, I actually wanted the farther
Oh,
offices
okay.
because the farther offices are busier, you know.
Oh,
So
there
it
you
worked
go.
out perfectly for us. He's like kind of winding down a little bit, and so he's not looking for a long day every day. So it worked out perfectly. I prefer the busier ones. He preferred the ones that aren't as busy, and he didn't want to drive as far. And I actually don't mind driving as far.
Nice. That
Yeah.
worked out. So two questions from the same person, and
Mm-hmm.
I don't know the answer to these questions. I don't think you're going to either, Doc. So
Mm-hmm.
I'll get to you. I'll get you the answer, and we'll get that to you after this call. But what's the median employment time range for an oral surgeon working for Aspen full-time and part-time? And also, what is the median age of an oral surgeon at Aspen?
What was
And
the
I've
first
never been,
question? What is the
what
what?
is the median age and the time of employment? So I guess
Oh,
how
the
long
time of point.
have they been with us? I
You're
don't know if you
right.
have any insight to that, because I don't.
I mean, my sense is from being here over the years, not many people leave. Um, Voluntarily at least, not many people leave. um, but it seems that when doctors join, they've been here for a while. At the guys I know that have, there are guys that have been here longer than me. So I couldn't tell you what the average is, but we're also adding new doctors all the time now. So there's new doctors coming in at the same time, so that would lower the age.
Yeah. And
But the specialists don't tend to come and go. They come in and
correct.
stay for years.
Yep. And I
Mm.
know that in recent years, there have been a lot more, new graduates, new residents. That's something that the specialty team has kind of been working toward to really, that's where I come in. That's where my team comes in on the academic side, which there was no academic team a few years ago. So I would imagine that the average age has probably shifted quite a lot in the past few years because now we have people like myself who go out to the residency programs and kind of be that brand ambassador for Aspen and meet residents that want to come work for Aspen right out of residency. So it's a good question. I'm curious myself. I'm going to find out. Definitely going to find out. So I know you didn't join Aspen right out of residency, but based on your experience, would you recommend an oral surgeon out of residency to come to Aspen?
It depends what you want, what you're looking for. For me, I can honestly say I wish I would have stumbled onto this when I first started in practice. If I look back at what I did over the years, um, I would have been thrilled to come out of residency and come right into this. It's if there's no other message I can leave you with tonight, Aspen Dental presents you with a tremendous opportunity. It's not for everybody, but it's good for a lot of people. And it's sitting right in front of you right now. You kind of have to look at it and evaluate it. But I can honestly say they create a tremendous opportunity for dentists, whether you're a specialist or a general dentist. Um, you're looking at a potentially fantastic opportunity here, and I honestly mean that. It's a great place to practice. I just wish I would have started earlier, but if for a young guy coming out, you can get going so quickly and get to where it would take years to get if you either went to practice with another doctor or started your own practice. And honestly speaking, you probably would never get to the same situation. And the organization is fantastic. I'm sure there are concerns about involving business people with medical people, but I can honestly tell you, I've never encountered an issue. I'm kind of free to to do whatever I want to do. I have flexibility with my schedule. There are a lot of advantages that, you know, we may get into before the day's over, but I love it. It's fantastic for me.
That's awesome. That's so good to hear.
Mm.
That really is. I had a general dentist in a practice that I visited when I was coming on to Aspen, and he owned his own practice for 20 years before he decided to come over to Aspen and eventually buy a few practices in the Aspen network. And he said to me the same exact thing that you said, and that has stuck with me ever since. He said, I wish I would have done this 20 years ago. He said, what took me 20 years to build outside of Aspen took me 3 years to build in the Aspen network.
Yeah, and I can honestly say I feel indebted to Aspen Dental. Like I'm grateful for what they've done for me. And it's a big organization, but I can honestly tell you, I know the people from the top down. All the, you know, there are meetings and things we do to get together, and you know, that's part of becoming comfortable with it. I know from the CEO down in the company, all the people that are in Syracuse running it, and I'm, you know, it's I can vouch for them. It's a good group of people.
I agree. I agree 100%. And we have a lot of fun when we get together too,
Exactly.
on top of everything else.
Not this year, but
No, well, yeah,
yeah.
hopefully next year. So if someone is coming out of residency to become an oral surgeon with Aspen, do you feel that, it's kind of worded a little funny, the question, but I think what they mean is, do you feel that without having, let's say, another oral surgeon, experienced oral surgeon looking over your shoulder all the time, that you know, they would be well prepared?
There's an advantage to joining somebody else for a while. I joined somebody, and you know, when I was in residency, the last thing we wanted to do was dental alveolar surgery. I did very little of it in my residency, whatever the minimum requirement was to finish. We wanted to do trauma, we wanted to do orthodontic surgery. Back then, maybe now too, people wanted to do facelifts and rhinoplasties. And so the last thing we wanted was dental alveolar surgery and anesthesia. When I came out, I actually wasn't that good at it when I first started. So, and there is a skill to being good at it. I joined another oral surgeon, and I used to do his anesthesia for him. So I would see him work every day, and seeing him work helped me out a lot. Now, on the flip side, when you come and join Aspen Dental, this is the thing you kind of have to grapple with. If you're full-time with Aspen Dental, you're giving up the part of oral surgery that, you know, that involves trauma and orthodontic surgery and that type of thing, and you're going into doing primarily dental alveolar surgery and implants. Now, the advantage you have is there's no requirement about how much time you have to schedule your appointments for. If you're not, you know, that fast when you start, there's absolutely no problem. You're asked when you start how much time you want for your procedures. If you need 2 hours to do something, you can tell them I want 2 hours for a full mouth. As you practice and build up your speed, you won't need 2 hours for things anymore. And some people, you know, prefer not to work at a rush pace. I prefer not to work at a rush pace. So there's a limit to how many procedures I'll put one after another. And I can choose that, and no one, you know, has ever made an issue one way or the other of that. So you can choose how much time you need for things. As far as building up your confidence and having another oral surgeon looking over your shoulder, it's nice to have that. But again, what you're doing at Aspen Dental isn't the most complicated surgery. It's dental alveolar surgery. So, you know, a lot of that you just learn by practicing. You know, it doesn't involve as much of somebody looking over your shoulder, but there is a skill to it, getting better at doing surgery and anesthesia. You just don't want to rush yourself. You give yourself plenty of time. And as you get faster and build up your confidence, you can shorten those times.
Sure, makes sense. COVID questions. We're getting to the end of the hour here, so we'll try to make this quick. I want to be respectful of your time and everyone else's. Are you seeing less patients than you were before with the COVID situation? And do you have the proper PPE necessary every day, specifically N95s?
Yeah, one of the advantages to, again, being with a big organization like this, that's Shine's biggest customer, it can, I don't know what the situation is now, but, and we're probably kind of spoiled. There's never been a time where we didn't have N95 masks. I actually didn't work for a couple months at the beginning of the COVID issue because in most states they limited care to emergency care. So I was available for emergencies, but a lot of what we did really wasn't an emergency. So even at that point, when it was almost impossible to get N95 masks, we had N95 masks. There's never been a problem with N95 masks here. And we have anything you want. You can have gowns, you can have shoe covers, you can wear a hat. They have face shields. All that is there and it's available to you. There's never been an instance since this COVID issue started where we didn't have that stuff. And honestly, I think we're probably the first people to get it. There's probably not too many organizations that have more clout in terms of having that stuff. As far as appointment times, I will say Aspen's been fantastic in dealing with this COVID situation. There were weekly conference calls as it was going on, and they monitored state by state what was going on with every state. And it can be hard to keep track of what's going on in a state. All I'm interested in is Pennsylvania, but they knew what was going on in Pennsylvania before I knew what was going on in Pennsylvania, and I'm watching it close. So they actually did a fantastic job, I think, handling the situation.
That's awesome. So do you administer anesthesia all day or only in the morning?
All day.
We're gonna go quick. It's like the lightning speed round now. It's 7:59. This is not
I'm in no hurry.
This is not a question that I want to end with, but someone did pose the question, and if nobody did, I would have asked you because I always like to be, you know, open and transparent. What would you say you like the least about working for Aspen?
You know, this sounds fake, but there's not much I don't like. I can't think of anything that I despise. I think if you ask most of us, the main thing would be the amount of driving that we do. But I've been doing it for so long, I actually don't mind the drive. You know, when I tend to get something to eat on my drive in. So, you know, it gives me some time. I listen to a radio station morning show here in the morning when I ride in. I have a nice car that I drive in with, and I have my breakfast as I ride in. Then I work during the day. I usually don't take a break for lunch, but I have breaks. If I wanted to go out and get lunch, I could go get lunch. And you can schedule lunch if you want to have a lunch, but I kind of work straight through the day. And then on my ride back, I get to pick up something to eat on the way back. That's actually my lunch. And I have satellite radio in my car. The things, if I was home, I'd be sitting kind of indirectly watching what I'm listening to anyway on the satellite radio in my car when I ride back. So I would say the driving is what I like the least, but the driving is not that bad. I actually don't mind the driving. So
if this was Family Feud, that would be the #1 answer. Everybody says
yeah, I'm sure everybody says that. You know, it's more logically thinking about it. You know, as I'm doing it, it doesn't bother me at all. But logically, as I think about it, I think, well, I'm spending, you know, this much time every day in a car driving. You know?
But you make the best of it. Like you said, you listen to your
I don't mind it, to be honest.
Satellite radio. You can unwind a little. It's quiet time.
Yeah.
As I mentioned,
it's actually gotten easier now with COVID because there's no traffic.
Less traffic, exactly. And I mentioned before, I have 2 young kids. So for me, driving is like by myself.
Yeah.
That's a real pleasure. So the question that I always like to end with is the complete flip side of that. And it's kind of like, what do you like the most about Aspen? And you have said such nice things already. So I don't know if you can top what you already said, but if you have any last anything else that you want to kind of get out there? Any last pearls of wisdom to the people that are listening?
I mean, I think people have a sense of this, that there are a lot of advantages to doing this. If you're in private practice, for example, you look at it as, well, I'm in control of everything. I can take time off if I want to take time off. It's actually not that easy to take time off in private practice, because there's always the fear that I'm gone and I'm not around to get referrals from the doctors that refer to me. So I don't want to be gone too long. The nice thing about here is I can schedule whatever I want. I can make the schedule any way I want to have it. We have some doctors that work 3 weeks and take a week off. We have doctors that work 4 days a week and take Friday off. If you wanted to, you don't have to work a whole day. You could work, if the driving is a big issue to you, you could work a 6-hour day and add the driving in, and you're still home at a reasonable time if you don't want to get home late. So there's a lot of flexibility in terms of how you schedule yourself. And then there are obvious advantages. You can be very busy very fast. If you come out of residency, the average doc in practice a lot of times is worried about where the next patient is going to come from. There's a big part of practice that some docs don't like is trying to get referrals. Here, the referrals kind of come automatically for you. Granted, it's not a captive audience. You still kind of have to keep the doctors happy, and but unless there's a big falling out or something like that, it's a lot nicer than having to send presents and for lack of a better word, schmooze people for referrals. Another good thing that I like is the relationships I have with people. It's not like you're in your own little cocoon and you don't see anybody other than your office staff every day. I see different people every day. I see the doctors that refer to me. I know them all personally. A lot of them are my friends. If you're in private practice, you don't really see them every day and get to know them. Everybody that I deal with knows me personally. And then these offices are owned by doctors. There are doctors that own groups of them. The doctor that owns most of my office is a fantastic guy. I would do anything for him. He would do anything for me at this point. So then another nice thing about it is you interact with a lot of colleagues and a lot of people instead of being enclosed in a little isolated cocoon, is the way I kind of look at it. Yeah.
Yep, you have a huge network with Aspen.
Yeah.
Yep. I think you said it all. I don't think we couldn't get any better than that. So
yeah, I think it's coming across that I really like it.
I think so too.
Yeah, and I think a lot of other people would too.
Yes, agreed. So it's 8:05. I want to be respectful again of your time and everyone else's. So that is like a perfect way to wrap things up. Thank you so much, Doc, for doing this for us, and you were fantastic. And I think it's safe to say that everyone at Aspen loves you as much as you love everyone else. So thank you.
And thanks everyone for joining us tonight. I wish you luck in whatever you decide to do. If anyone wants to talk to me personally, Melissa can arrange it. I'm glad to talk to anybody
Absolutely.
personally if you have questions for me personally.
Thank you so much. We appreciate that. And have a great night, everyone. Bye.
Good night.